Hello friends, I am Dr. Krishna Patil. I am a consultant nephrologist and today I am going to discuss briefly a very vital important function of kidneys, that is the acid-base balance. So the kidneys are the vital organ which maintain the blood pH between 7.35 to 7.45. The other important organ which helps the kidneys is the lungs. So lungs excrete carbon dioxide and thus they excrete the carbonic acid. So the acid load is reduced by the lungs excreting exhaling the carbon dioxide, and the kidneys, they excrete the acid load in the urine, and also the other thing that they generate is bicarbonate. So bicarbonate is the base which neutralizes the acid in the blood and helps to maintain the blood pH between 7.35 to 7.45. So kidneys help to maintain life by maintaining the blood pH in this narrow range, which is important for our life. Now, when the kidney disease sets in, then this acid-base balance becomes disturbed. So the blood starts to become more acidic. The pH starts to decrease below 7.35 because the bicarbonate generation by the kidneys is less and its capacity to excrete acid load is less. So the bicarbonate level starts to decrease below 22. The normal blood bicarbonate level is between 22 to 26. Now, how a kidney disease patient should deal with this acid load in their blood? So it is very important to reduce the acid load in one's diet. So what are the foods that increase the acid load? The most important restriction that as a nephrologist we recommend to our kidney disease patients is restricting their animal protein, which is high in uric acid, phosphorus and sulfuric. All these acids are high in animal-based proteins. So protein restriction from animal source is an important restriction to reduce the acid load from diet. The second important thing is to restrict fast foods with preservatives and to avoid overcooking or repeated heating of food, which also makes the food more acidic. Second important thing is to include more alkaline foods in your diet. What are the foods that are more alkaline? The most important the basic source in our diet are the fresh fruits. Now, one problem with kidney disease is the inability to handle the potassium load in the fruits. So we recommend low potassium fruits, which are the apples, papaya, guava, pear, oranges, pineapple. These are relatively low in potassium and give good amount of alkaline or base in our diet. So including these fresh fruits like apple, papaya, guava, pear, oranges, pineapples is important. Second is having good bowl of vegetables in our diet, having a good salad quantity in our diet. The grains should be whole grains and the pulses preferably should be with cover. So these are the foodstuffs which make our diet alkaline and reduce the load on our kidneys of excreting the acid. So this dietary recommendation is very important for all patients with kidney disease, and not only kidney disease patients but other healthy individuals with comorbidities who can develop kidney disease. To reduce the load on their kidneys, it's important to follow this diet. When with this dietary restriction or including the fruits, vegetables, salads, whole grains and pulses with the covers, if they are unable to maintain the blood bicarbonate between 22 to 26, that's the point when we recommend them to take sodium bicarbonate supplements. So we prescribe them medicines to maintain this blood pH so that the kidneys are not overloaded and the blood pH is maintained in a normal range. So a prescription of sodium bicarbonate supplement is essential at this stage. Generally, this happens when the kidneys have reached to a stage of chronic kidney disease stage 3 or 4 or 5. Beyond stage 3, the acid-base imbalance starts to set in. Thank you.